Today marks International Nurses Day, which is being commemorated on the birth of Florence Nightingale, who was considered a pioneer of the sector. The Democratic Nursing Organization of South Africa, alongside many others, hosting events today in honor of healthcare workers. Newsroom Africa's Zikhona Chona has more.
We were busy actually with handover. That was between day stop and night stop, the matrons. And the call came and I just heard screaming.
A chilling account following the evening when two patients and a police officer were shot dead inside the New Somerset Hospital in Cape Town. According to police reports, on a Saturday night, a police officer tried to intervene during a commotion at one of the wards. The suspect was able to wrestle a gun from the police officer before shooting him through the head and killing two other patients on the scene.
That police officer was in the ward in that he was accompanying another patient who was under police guard. That patient was not involved in this event at all, and the policeman had become involved because of the aggression shown by the assailant, who was one of the other patients in the ward. This was a frightful scene.
The nurse on duty that evening, Sister Diane Seal, disarmed the assailant after finding the police officer lying in a pool of blood.
I sedated him, and he actually assisted by holding his arm and lifting his sleeve. And once I saw him going into the full sedation, I got him under the bed. I asked him actually, and he got down. And from there on in, I just said, speaking through, until full sedation happened. That's when I could go to the door and ask the tactical team.
The incident highlighted the volatile conditions nurses, doctors, and hospital staff members have to work in.
We come to work to sort of, help our patients, and we live for our patients. And the last thing we want is to be feeling unsafe, And I think we can do more, There can be more resources towards, not just security, but other things around security, perimeter. I think there needs to be a real look at SOPs and policies that manages gun control and sort of our relationship with the SAPS and correctional services,
The suspect was identified as former police officer John Paul Malchus, who is now facing 3 counts of murder, illegal possession of a firearm, ammunition and robbery. During his court appearance on Tuesday, the 39-year-old told the presiding officer that he was not going to apply for bail and that he suffers from severe depression and suicide. The case was postponed to the 30th of June for further investigation. For Newsroom Africa on Channel 405, I am Udirile Ramafi.
And of course, that was Udile Ramafi reflecting on the shooting that took place this weekend at the Somerset West Hospital. Let's continue here tonight. The South African National AIDS Council today facilitated the signing of the new Global Fund grant valued at over 8.8 billion rand for the next 3 years. The money will be used to tackle HIV and TB in the country. Health Minister Dr Joe Phaahla acknowledging that the HIV and TB projects have taken a knock in recent years due to the COVID-19 pandemic. We're joined now by SANAC Co-Chairperson Steve Letsike and Global Fund CCM Chairperson Dr. Thembi. Good evening to both of you. Thanks for your time. Steve, let me kick it off with you. During the last 2 years, we've heard quite extensively how programs relating to HIV and TB, including in some instances during the pandemic, treatment had to be completely, stopped because of the challenges in accessing it. Overall, now that we are post the, well, not quite post the pandemic, but at least the restrictions, what would you say has been the overall impact of these last 2 years on our HIV and TB programs?
Now, good evening to you, Kathy, and to the viewers of Newsroom. Indeed, the last 2 years have taught us a great deal in terms of what really signals a threat to the public health, but also to the gains that we have achieved over the years. As you are aware that, we have the highest HIV epidemic, with over 8 million people living with HIV. But we also have the biggest ART treatment program in the whole world. Now, you can just imagine with the commitment that we have put as the country to say that we're going to put 2 more million people in 2020, and then we knocked by COVID-19, which then means we are not able to reach the target. Secondly, we're also not able to ensure that every person who's living with HIV can have equitable access, to treatment during this time of restrictions. Now, we've taken that knock, and this is one of the reasons why, as a council, we've called off a fast-track approach where we've seen community groups, including government, working together to ensure that opening up other spaces beyond the public health sector was necessary to ensure that we dispense medication.
Dr. Xulu, let me come to you and talk about then these funds that have been allocated towards South Africa. How significant are they going to be towards our overall projects for HIV and TB?
Thank you so much, Kathy, and good evening to yourself and to your viewers. I think the funds that the country has received to the tune of $546 million between 2022 and 2025 is going to be important. I would say, one, in terms of supporting the setbacks that the program has experienced in terms of what Co-Chair was describing. So what we need to start doing is to make sure that we accelerate getting people back on treatment, working with the Department of Health to make sure that the back to care campaigns work. And this means strengthening things like differentiated models of service delivery by taking treatment back to the people. What we also saw is that the TB program took a huge knock in terms of the TB HIV response because of COVID. So the Global Fund has actually increased its allocation towards TB from 8% to 26% to make sure that we find those missing TB cases and we x-ray those patients that are asymptomatic but actually do have TB in order to make sure that we have control over the TB pandemic, which TB continues to be the #1 cause of mortality for HIV-infected patients in South Africa. And I think one of the things that Global Fund has been great about is supporting human rights in South Africa. Goal 5 of the NSP says the HIV-TB response in the country has to be human rights-based, which means we respect the human rights of HIV-infected people, but of all key and vulnerable populations. And this is a program that we are expanding in terms of making sure that the response is led at community level, driven by communities, and responsive to what the communities put forward as their needs. These are some of the areas that the Global Fund is supporting.
Dr. Xulu, when we talk about TB in this country, what's alarming is that, some of the latest figures show that the numbers of people who are living with TB are almost, double what they are estimated on paper.
It's absolutely true, Kathy, and I think we saw this when the results of the TB prevalence survey came out. We saw a very high increase in TB in men than we expected. We saw a high prevalence of TB in the ages of over 65. And we also saw that there's quite a significant number of patients who actually on normal screening and sometimes even on sputum don't show TB, but it's only when you do a chest x-ray that you pick up the TB. So the Department of Health is leading what we call a TB recovery plan, which is about finding the missing TB patients, as I mentioned, and expanding screening, at primary healthcare level to make sure that we find our patients. But more than that, I think there's also expansion in terms of regimens that are more user-friendly and not toxic to the systems of our patients, not just in terms of prevention, but of treatment. Normally, the TB prevention methods that we use would be 6 months, but now we are expanding a 3-HP regimen, which is much more user-friendly and shorter, and it is a fixed drug combination. So I think the efforts that the department is putting in terms of strengthening TB will make sure that we do get a handle in order to make sure that when we catch TB early, TB is curable, and we actually avoid the progression onto a multi-drug resistant TB development.
Steve, one of the reminders here is the fact that despite running, the world's biggest antiretroviral program, as you were saying earlier, South Africa's efforts in the fight against HIV and TB cannot be won alone. And, this support from international partners continues to be crucial to our efforts.
No, indeed, Kathy. Look, we are quite clear as SANAC and as our national strategic plan says, spend now in order to save later. And this is why we take the approach of multisectorality. Civil society within SANAC has been consistent in their approach at community level, at the advocacy level, even the drug TB recovery plan that Dr. Xulu is referring to. It was the call of civil society to say, take it back to the communities. And what we are saying, even with the investment that is coming, both at the level of development partners and domestic resources, whether you're talking global fund, as you see the commitment of 8.8 billion for the next 3 years, we have indicated that this money must benefit the beneficiaries, the communities. So that means an investment of that level must go to that level, to the communities. Now, what is significant of this work? Civil society is organized, it's institutionalized, self-governance approach is what it's implementing. And that's why the mechanism of interventions at a social level to respond to the social cohesion interventions that are needed is what civil society can bring. Government has to tap onto and leverage on the expertise that civil society brings, because it's not only just community driven, but it's also research. It's about service delivery and as well consistency within the trusted allies, which is then civil society.
Steve Letsike, let me thank you for your time. Co-Chairperson of SANAC and Dr. Thembi Xulu.